Welcome. Today, we will explore a phenomenon as fascinating as it is disturbing: sleep paralysis. Have you ever woken up in the middle of the night, perfectly conscious but unable to move or speak? You may also have felt a dark presence in the room, heard strange whispers, or felt an overwhelming pressure on your chest. If so, you may have experienced an episode of sleep paralysis. This is an experience that has been associated for centuries with myths and legends about witches, demons, and even alien abductions. But what is true behind these disturbing sensations? Is it really a supernatural phenomenon, or can we explain it with science? Today we will discover together what happens in the brain during sleep paralysis. What are its causes? Why some see scary figures? And above all, how to deal with this phenomenon without letting themselves be overwhelmed by fear. Get ready for a journey between science, psychology, and mystery, because what happens in our minds while we sleep is much more fascinating than we imagine. Sleep paralysis is a phenomenon that has fascinated and frightened people for centuries. The person who experiences it tells us that he woke up in his own bed, perfectly conscious but unable to move or make any sounds. For some, it lasts only a few seconds. For others, it lasts for minutes, creating a feeling of impotence and anguish. What makes sleep paralysis particularly disturbing is that it is often accompanied by frightening hallucinations, dark shadows moving around the room, threatening presences that seem to observe the immobilized person, unexplainable sounds such as whispers, footsteps, or cries. Some even report feeling a weight on their chest, as if an invisible creature was suffocating them. Many, after experiencing this episode, wonder if they have experienced something paranormal or if they were victims of an inexplicable attack. Throughout history, sleep paralysis has been associated with witches, evil spirits, and even alien abductions. But today, science offers us a more rational explanation, revealing that the phenomenon has deep roots in the functioning of our brain and our sleep cycle. Understanding what happens during a sleep paralysis episode and what causes it can help reduce fear and develop strategies to better manage it. This phenomenon is not dangerous, but it can be very distressing. It is therefore important to learn how to recognize and react when it occurs. Sleep is divided into different phases: non-REM sleep and REM, rapid eye movement sleep. During non-REM sleep, the body relaxes progressively and the brain slows down its activity. The REM phase, on the other hand, is where most dreams happen and where the brain is very active, almost as if it were awake. During REM, the brain sends signals to paralyze the voluntary muscles, preventing them from moving while dreaming. This function is essential to avoid acting physically dreams, protecting the body from unsolicited or dangerous movements. However, in the case of sleep paralysis, the mechanism is blocked. The mind wakes up before the muscle block is deactivated. This leads to the feeling of being conscious but trapped in a still body. This state of hybridization between sleep and wakefulness can also lead to vivid hallucinations. During REM sleep, the brain is predisposed to create dream images, but in an episode of sleep paralysis, these images can overlap reality. That's why many people report seeing dark figures in the room, hearing whispering voices, or feeling overwhelming pressure on their chest. Although anyone can experience sleep paralysis, some factors increase the likelihood of it. The first and most common is sleep deprivation. Poor sleep or an irregular sleep-wake rhythm interferes with REM cycle and can predispose to episodes. Another factor is stress and anxiety, which alter the functioning of the autonomic nervous system and increase the likelihood of an incomplete REM wake. Postural habits also play a role. Sleeping supine, with the back resting on the mattress, seems to favor episodes, perhaps due to increased pressure on the lungs or an alteration of cerebral blood flow. There are also medical conditions associated with sleep paralysis. Among these, narcolepsy, a neurological disorder characterized by sudden sleep attacks and abnormal REM phase regulation. Sleep disorders such as obstructive sleep apnea, where breathing is stopped several times during the night, can also increase the risk of experiencing paralysis episodes. Certain drugs, such as antidepressants and stimulants, can alter the sleep-wake cycle and increase the likelihood of episodes. Finally, genetics may play a role. Some research suggests that the predisposition to sleep paralysis could be hereditary. One of the most disturbing aspects of sleep paralysis is the hallucinatory component. These experiences can be visual, auditory, or tactile. Some report seeing dark shadows or indistinct figures at the foot of the bed, while others hear unexplained noises such as whispers, steps, or voices. A common hallucination is the feeling of a presence in the room, often described as hostile or threatening. This perception may result from an overactivation of the amygdala, the part of the brain responsible for responding to fear. Because the brain is in a state of alarm, it can misinterpret neutral stimuli as dangerous. Another widespread feeling is that of chest oppression, as if something or someone were pressing on the chest, making breathing difficult. This phenomenon has given rise to numerous legends about witches of the night or demonic beings sitting on the victim's chest. Some scholars have linked sleep paralysis to the feeling of alien abduction, suggesting that many testimonies of extraterrestrial encounters derive from episodes of hypnotic hallucinations. There is no specific treatment for sleep paralysis, but some strategies can reduce its frequency and intensity. The first step is to maintain a regular sleep, sleeping at least 7 to 9 hours per night and avoiding shifts in rest times. Reducing stress is equally important. Relaxation techniques, such as meditation or deep breathing, can decrease the activation of the amygdala and prevent episodes. Avoiding caffeine, alcohol, and stimulants before sleep helps to stabilize the sleep-wake cycle. Posture is also important. Sleeping on your side rather than supine can reduce the likelihood of episodes. If sleep paralysis is common and affects quality of life, it may be helpful to consult a sleep specialist. In some cases, doctors may prescribe drugs such as tricyclic antidepressants or serotonin reuptake inhibitors, which regulate the REM cycle. When you are in a state of sleep paralysis, the most important thing is to stay calm. Although the feeling of immobility can be frightening, knowing that it is a temporary and harmless phenomenon helps to reduce anxiety. An effective way to stop the episode is to try to move a small part of your body, such as your fingers or toes. Even if the main muscles are paralyzed, small movements can help to break the paralysis and completely wake up the body. Another useful strategy is to focus on breathing. If anxiety increases, it is easy to fall into a quick and shallow breathing, which can make the choking sensation worse. Breathing deeply and slowly helps to maintain control and relax the body. Some people find relief by trying to relax and go back to sleep. Sleep paralysis is often linked to REM, so if you let yourself go to sleep, the natural cycle will lead to the end of the episode. If sleep paralysis is accompanied by frightening hallucinations, it may be helpful to focus on positive thoughts or imagine being in a safe place. This can reduce fear and alter the hallucinatory experience. Another technique is to try to make a sound, even just a little moan or a louder breath. If there is someone nearby, this could wake them up and interrupt the episode. After an episode of sleep paralysis, it is advisable to get up, walk, and drink a glass of water. This helps the brain to fully reconnect to wakefulness, preventing the paralysis from repeating itself in case you fall asleep again. If episodes are frequent, it is useful to maintain a good sleep-wake rhythm, avoid caffeine and bright screens before sleeping, and try to reduce stress. Creating a comfortable and relaxing sleep environment can improve the quality of sleep and decrease the likelihood of experiencing episodes of paralysis. With these strategies, it is possible to better tackle sleep paralysis and reduce its impact on quality of life. We have seen that sleep paralysis, as terrifying as it may sound, is a natural phenomenon linked to our sleep cycle and the way the brain handles the transition between sleep and wakefulness. There are no demons or dark presences, but a set of neurological mechanisms that, under certain conditions, can create vivid and frightening experiences. Understanding the phenomenon is the first step to face it with greater serenity. Maintaining good sleep hygiene, reducing stress, and knowing strategies to stop an episode can make the difference between a distressing experience and a greater awareness of one's body and mind. If you have ever experienced sleep paralysis, tell us about your experience in the comments. How did you experience it? What feelings did you have? Were you scared, or were you able to stay calm? If you liked the video, leave a like and join the channel for more insights on dreams, sleep, and neuroscience. Thank you for accompanying us on this journey into the world of sleep. See you next time.